The same MRI that costs $400 in Japan costs around $4,000 in America. Same machine, same scan, sometimes built by the same manufacturer. That gap doesn't go to better care. It goes somewhere most people will never trace. And once you see where, you can't unsee it. Here's what nobody tells you when you walk into an emergency room. You're not the customer. You don't pick the service. You don't see the price. You don't even sign the bill until weeks later when a piece of paper arrives that may as well be written in another language. Every other industry in America revolves around the buyer making a choice. Healthcare revolves around the buyer being kept in the dark. That darkness isn't an accident. It's the business model. Start with something called the Chargemaster. Every hospital in America keeps a secret price list. A bag of saline that costs the hospital around $1 appears on the Chargemaster as hundreds. A single Tylenol, $15. Stitches, thousands. The Chargemaster isn't real pricing. It's the opening bid in a negotiation you're not part of. Insurance companies bargain it down to a fraction. The uninsured get the full hit. Nobody actually pays the Chargemaster price, except when someone does. And that someone is usually the person who can least afford it. But here's where the real machinery starts turning. Because behind every bill, there isn't one company making money. There are 5. There's the hospital, which has consolidated so aggressively over the last 20 years that in most American cities, 1 or 2 health systems now control nearly every facility within driving distance. When you have no competition, you don't lower prices. You raise them. Then there's the insurance company, which doesn't actually want lower prices. This is the part most people get wrong. Insurers are allowed to keep a fixed percentage of what they spend. So if they spend more on healthcare, they're allowed to keep more in profit. A cheaper system would shrink their margin. They have a quiet structural reason to let costs climb. Then there's the pharmacy benefit manager, the PBM, a middleman almost nobody outside the industry has ever heard of. A handful of companies control the vast majority of this market. They negotiate drug prices on behalf of insurers and pocket the spread between what they pay and what they charge. The bigger the gap, the bigger the cut. You will never see them on your receipt. They are designed to be invisible. Then there's the drug manufacturer who can charge whatever the market allows because Medicare, the largest single buyer in the country, was specifically forbidden by law for nearly 2 decades from negotiating most drug prices. That law didn't appear by accident. It was written by people who later went to work for the industry that benefited. And finally, there's the lobby. Healthcare spends more in Washington than almost any other industry on earth. Every reform that threatens the system gets watered down, delayed, or quietly killed in committee. The system isn't broken, it's working exactly as designed, just not for you. Now you might be thinking, what about non-profit hospitals? Aren't most of them charitable? Technically, yes. They pay no taxes. They receive massive public subsidies, and many of them generate enormous surpluses while their CEOs make millions a year and their collections departments sue patients into bankruptcy. The word nonprofit describes their tax status. It does not describe their behavior. So when you look at your hospital bill and feel that hot, helpless confusion, that's not a personal failure. That's the intended response. Confusion is the product. The bill is designed to be incomprehensible because comprehension would lead to questions, and questions would lead to demands, and demands would lead to change. The reason American medical care costs what it does isn't because doctors earn too much, or because the technology is too advanced, or because Americans are sicker. Other countries have the same doctors, the same machines, the same diseases. What they don't have is 5 layers of intermediaries, each taking a cut while pointing at the next one in line. The bill isn't expensive because the care is. The bill is expensive because nobody in the room is on your side.